Let's talk about autologous conditioned serum, or ACS. In your office, you probably recognize that this is the most substantial treatment we have in non-surgical hair restoration, and it's the staple of the non-surgical program for both men and women. The entire program is focused around these treatments, because you're going to have 4 of them separated by 6 weeks. And during those treatments, we're not only providing the treatment itself, we're actually going over your home regimen or getting feedback on the home regimen you've been trying, refining that such that by the end of the 4 sessions, we have everything done. Everything in the office that we do for non-surgical hair restoration surrounds ACS. So let's really quickly talk about ACS again. We have videos on both men and women getting ACS, but this is a treatment that revolves around wound healing, and it's an evolution from PRP. It's something that we brought over from orthopedic surgery, and I brought it over after I had my own shoulder repaired using ACS. Now, in PRP, what we do is we draw the blood, we try to isolate something called platelets. But during that process, we actually spin the blood down very, very, very hard, and the cells rupture, releasing their growth factors into the plasma, in addition to having platelets, some whole and some fractured in that area. And when those growth factors and remaining platelets are injected in the scalp, they actually stimulate hair growth for hair, skin, blood vessels, along with a lot of other things involved. However, it's just a pool of growth factors going out there and not a coordinated process like your body would normally launch to heal a wound. About 60% of people respond to PRP. The response tends to be pretty temporary, and people will do PRP every quarter, every 6 months, every year, however long in between it be, to maintain the results. Now, ACS is different. It originated in orthopedics, and I was trying to figure out ways to tell people why it originated. But I tell people, hey, think about a joint and how small a joint is and how little fluid can fit into that joint. And if an orthopedic surgeon wants to regenerate a ligament, a tendon, or some cartilage, they really have to purify blood down to the most important components to get that to happen. And that's how they developed ACS. And ACS can stand for autologous conditioned serum, autologous cellular serum, whatever it be. But if you look up the literature, you'll see that they're seeing in osteoarthritis, ligament generation, tendon generation, ACS is outperforming PRP. Why does it do that? Well, in the process, we don't care about the growth factors themselves. We actually care about the wound healing response. If you think about wound healing, a couple things need to happen for wounds to heal. Number one, you got to get new blood vessels to the area, to rush in, to provide nutrients, and to remove the waste from the site such that wound can heal. Whenever you pull off a scab, it bleeds profusely because the wounds have a very nice bed called granulation tissue. So number one, our growth factors for neovascularization, which means new blood vessels, and better blood flow, dilation of blood vessels. Same time, logically, you got to get skin and hair cells to replicate. These cells originate in the same parts of the skin, so the ones that help skin grow also help hair grow. And these growth factors, EGF, particularly epithelial growth factor, are in there to help the wound. Now, when the body heals a wound, though, it doesn't dump all these growth factors out at some time. There's a couple of cells that follow each other that coordinate the release of the growth factors. Platelets signal neutrophils, signals white blood cells, signals fibroblasts, signals everything else that happens. It happens sequentially, not just through release of growth factors, but through paracrine interactions. Paracrine interactions are actually cells talking to cells closely together, sometimes through physical tentacle touch, and sometimes through release of hormones that really that cross a very short distance to activate the next cell. It's a coordinated process. And ACS, we are actually trying to preserve that process. And the way we do that is by taking a lot more blood, approximately 4 to 10 to 12 times the amount of blood, isolating the cells by slowly processing blood, not spinning them down at a very high rate such that the cells are rupturing, so spinning them down at a very slow rate, and not trying to get a lot of volume out. Remember, orthopedic surgeons don't need a lot of volume, they just need a little bit, focusing purely on the cells. And that purification of the cellular component, autologous cellular serum, is actually what leads to a better wound healing response, which is analogous with hair growth, or I think is analogous with hair growth, and why I've been having such great results. So what happens in our office is that we do ACS instead of PRP. We actually just don't do PRP anymore. You can get that at our medical spa we're associated with, but not in the hair practice. And we actually take a lot more blood. We need more kits. Each kit is about an ounce of blood, which results in so many billions of cells, of white blood cells and platelets that are involved in this wound healing process. And imagine the amount of space in the joint versus your scalp. So typically one kit will cover the front top, one will cover the front back, one will cover the temples, one will cover the back the head, we'll cover down the neck. 5 kits is what it takes to cover the scalp at a normal concentration. However, in my experience, I found that if you actually increase the concentration of cells even more, you can get a better response. So you can actually put 2 kits in the front area, 2 kits in the back, 2 kits in the temples, 2 kits in the back of the scalp, and 1 below above the neck. Or if you're trying to save on costs, you can actually dilute a kit down, and one that would normally cover 1 area, but try to cover 2 to see if you get a response. And if you get a response later on, add more kits because you know you're a responder at that point. So the number of kits is purely because we're covering a lot more area. Think about the joint versus the scalp and how many cells come out of 1 kit, because these kits are meant for orthopedic surgeons. They're not meant for hair doctors. So when you're looking at the cost of ACS, I do know this is an expensive therapy. We do have some cost saving measures through Northwestern Hair Lab, but typically 1 session, no matter how many kits you do, the physician's fee is $1,500. And every kit you need for each session, each kit is $1,000. So if you have 2 kits recommended to you per session, that means you have a $1,500 injection fee for 1 session. And you have 2 kits, which are $1,000 each. So it's a $3,500 session. But you need 4 of those sessions, usually. So that can lead to more expensive treatments. Now, the office will help you package together multiple treatments to help save cost. But Northwestern Hair Lab is also a great way to save an ACS treatments. One of the things I really like to do is to innovate on our techniques, and I really like to create content like I am here to educate people. If you want to be involved in Northwestern Hair Lab, the physician's fee, almost all of it can be negated. Actually, all of it can be negated. Prefer to participate in a way that protects your privacy, such that we're not taking pictures of your face or you're staying out of the frame of the camera. Half that physician's fee can be waived by doing Northwestern Hair Lab and just participate in the innovation side. The innovations are always changing. We're working on right now. I'm looking at a treatment called injectable dutasteride. It's 2015 November, so this could be old by the time you watch it. Injectable dutasteride is different than oral or topical. It's coming over from Europe to US, and I want to be one of the first people to bring it to the US. I'm offering that to people as part of their ACS packaging. You can also decide that you're okay with your face being shown on camera in pictures and videos, and you're okay with your personal experience being shared through testimonials with your name on it. In that case, all the physician's fee is waived. So Northwestern Hair Lab is a great option for people looking to save. It does help the practice quite a bit because we can innovate, we get to create content, and that's why, at least from my side, I like to give you guys that benefit, because I know this is quite an investment, and I want you to go through it. I want you to have options to make that realistic. So ACS, look at the number of sessions we recommend. It's usually 4. Sometimes you can start with 2 to see what your response is. People who have great responses that have tried other things in the past will go beyond 4. Sometimes do 5, 6, 7, or 8. That's great. We will make that decision together. Look at the number of kits, and then think about the ways of saving here, either through packaging all your 4 sessions into 1, or looking at Northwestern Hair Lab as a great opportunity to help us and to save the most you possibly can.